Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, listeners. I am Lindsay Smith Rogers, producer of Public Health on Call. Since March 3rd, 2020, Public Health on Call has brought you more than 400 episodes with evidence and experts to help unpack the day's COVID-19 and public health news and what it means for tomorrow. As we wind down Season 4, we have a few thank yous. First, a big thank you to our interns Kelly Corcoran, Caroline Wang, Alyssa Tsu, and Hannah Bennett, who bring fresh ideas and much-needed support for the podcast. We'd also like to thank you, our listeners, for sharing your ideas and questions and for downloading this podcast more than 6 million times. We're taking a break starting December 23rd, and we'll be back on January 3rd with Season 5 of Public Health on Call. We'll continue to cover the latest on COVID vaccines, treatment breakthroughs, and research. We'll talk about living with COVID and what our world might look like going forward as we move from pandemic crisis to endemic virus. We'll also cover other urgent public health issues, including racism, gun violence, mental health, climate change, and overdose. We so appreciate all the great ideas that come from our listeners, so please keep writing us at publichealthquestion@jhu.edu. And thank you for being part of this podcast. Today, I'm talking with co-hosts Stephanie Desmond and Josh Sharfstein for our Year in Review episode. We'll talk about closing out another year of the podcast, what surprised us about this year, our favorite episodes, some reading suggestions, and what we're most hopeful about for 2022. If you're after a laugh, be sure to stick around for the end. Let's listen. Stephanie Desmond and Josh Sharfstein, thank you so much for joining me today on Public Health on Call. So this is our second iteration of the sort of end of the year behind the scenes episode. We're closing out another year of Public Health on Call. And it's worth remembering where we were a year ago with the first U.S. vaccines were given emergency use authorization. We had 2 known variants. There's so much that has happened in public health since then. We're now all vaccinated and boosted. So just looking back at the year, what surprised you about this year? So let's start with you, Josh.
Well, I'm trying to put myself back in those last days of 2020 when we were very excited about vaccination and we imagined that the vaccines would really be very safe and effective, and that proved to be true. And we had some worries about whether people would get vaccinated in this country. We had worries about whether vaccines would make it around the world. We had worries about the variants, and all those proved to be true. So here we are like a year later, and it's a little bit of the more things change, the more things stay the same. We're now facing another variant. A lot of anxiety. We're in obviously a better place from many perspectives, but we're still not, I think, where we had hoped to be a year ago.
And Stephanie, what has surprised you?
I sort of can't believe we're still in the thick of it as we are. You know, we talked about vaccines, we were so excited, and yet we found that in many communities, people just aren't getting vaccinated. And I knew that from my public health experience that the vaccine hesitancy is a real problem. But I've still been surprised at how big of a problem vaccine hesitancy has been. I also am surprised that 800,000 people have died in the United States. You know, I really felt like we were going to make a dent in that, and we just haven't. Now, I know that if we hadn't had the vaccines, things would be a lot worse. And so I take comfort in that. But I'll also tell you that this is the first time now in December of 2021 that I have been told I'm exposed to COVID, that I've been getting calls from the health department telling me I've been exposed. I get my phone app has told me I've been exposed. And that's the first time this has happened. And I've been very careful for all this time. So I'm disheartened, I have to say, at this point.
Yeah, and those numbers are really hard to hear. I mean, I remember when we thought that 100,000 was staggering, and that just seems like ages ago. But, I do also want to say one of the things that has surprised me that we've talked about is the fact that we're still doing this podcast and we're still talking to each other. And it really surprises me that we've gotten through 6 million downloads of this podcast. That is amazing. I know that none of us expected to still be doing this, but that's one thing I think that has been really hopeful and has been a real positive coming out of all of this. So let's also talk about what's been going on in public health. Let's talk about some of your favorite episodes for this year. So Josh, you want to kick us off with some highlights?
Well, I'll pick up with what you said, that the podcast has been a source of strength in some ways for me personally. I particularly have learned a lot by talking to people on really critical issues that are emerging. The Novel Coronavirus Research Consortium is a group of faculty here at Hopkins, but at other universities and in other places, who work to analyze studies and really give you the bottom line for what they mean. And we bring those voices to life in these episodes where they usually 2 or 3 people pick a paper and explain, what it should mean for our lives. And I found those episodes really, really helpful to some of the key questions that are out there.
I think those episodes are really important too, because for me anyway, this is the first time that I'm hearing things like preprints and this kind of research, discussed and broken down in this way. And I think that public health has really gotten a whole new audience because of COVID-19. So that's another positive thing that's come out of this.
Lindsay, I have a question though.
Yes.
How did those episodes do? Is it just you and me that listen to them?
It is you and me and thousands of other people. We know that they are some of our most popular episodes. So we're really excited to bring the NCRC crew back in 2022. Maybe they can give us some new research around Omicron and some of these other things. So, Stephanie, what have been some of your favorite interviews this year?
One of the ones that sticks out, actually, it's 2 episodes that stick out to me, are the ones that we did with Jim Golan, who suffers from long haul COVID. And we've talked to him twice and seen sort of that he hasn't gotten better. Things have only gotten worse. And interviews with people like that are a real stark reminder of the fact that, for those who don't believe, COVID is real and COVID sticks around. Some people are very unlucky and it sticks around for a long time. So he got COVID in March of 2020 and he's still struggling. He can't work. And to me, that's something that I think it's overlooked. Like we talk about these numbers, 800,000 people dead, and so many more people are infected, but we think about it sort of as a zero-sum game, right? So you're either get better or you die, right? But there are a lot of people stuck in this middle space where they are neither getting better. Luckily, they're not dying, but they're not getting better. And so it's still impacting them in ways that we can't even imagine.
On the theme of really good episodes, and I really appreciate those, but also very disheartening episodes. We've had several where we've interviewed health officers or health officials who have talked about just how hard it is to be in public health at this time. And I think we also put on the podcast some of our school webinar interviews with health officers. And, they're from around the country and around the world. And they have these, unfortunate commonalities that people are working incredibly hard. They're desperate to save the lives of people they care about in their communities. And they are facing harassment, vilification, threats. Sometimes they're getting fired for it. It is really tough to listen to. I remember the podcast I did with Michelle Fiscus in Tennessee. And at the end, she said she didn't see a future for herself in Tennessee and she has left Tennessee. That was really a gut punch.
Yeah, I think the episodes, whenever we've had someone that has shared their own first-person story, those tend to really resonate with listeners. We get a lot of emails about them. We had one about POTS syndrome, and we got some emails about that. And I know, Josh, you've been really interested in talking with someone who maybe has made the journey from being vaccine hesitant to being more vaccine confident. So that's something that we'd love to talk to someone about. If anyone in our listenership has had that experience or knows someone that has, please reach out to us. You can always email us and we'll include the email at the end of the show.
Yeah, we have done some like that, including some that'll be airing this, around this time. I do think that some of those first person interviews, though, can also be uplifting. I think it's not all just the difficult moments. I'm thinking particularly of interviewing Terry Sapp, who is the Twisted Sister Rhodey, who is now running some of the most efficient and effective vaccine clinics for Baltimore County. And that's a guy who leaves nothing to chance. He has got like literally every inch of that, mass vaccination site planned, squared ahead, every single line, the way he just thinks about crowd movement. It was fascinating. And I think we were able to get some Twisted Sister music to accompany that episode.
We were. And actually, that's where my husband got vaccinated, and he was in and out of there in no time. He said it was the most efficient setup of anything he'd ever seen. So let's talk a little bit about another really important series of episodes that we did were in last May when we were remembering and honoring George Floyd. And we had a number of topics like the psychological impacts of racialized police violence, how racism keeps Black men in poverty. Josh, can you talk a little bit about some of those episodes?
Sure. We had two terrific guest hosts for those episodes, Dr. Rachel Thornton and Dr. Chidinma Ibe. And they brought on some very, very interesting guests to talk about the legacy of George Floyd and what had happened since and what needed to happen in the future. And, they covered voting reform as a public health issue. They covered the economics behind some of the police violence. And I found it very interesting, very popular among listeners. And I think it was really important to do that. And some of our other series, including on gun violence, that illustrate the broad reach of public health topics and how important it is to learn about them.
Another one of my favorite episodes was the one we did recently about the Supreme Court and the case from Mississippi about abortion. And we talked about abortion as a public health issue. And by the way, big thanks to our guest hosts for that episode, Annalise Winnie and Elisa Tsu, and to one of our sound engineers, Owen McCusker, who did just a phenomenal job mixing that. And so for people that don't know, Owen and Spencer and Owen's team of multimedia sound engineers, they take so much care with every single episode, and they are helping us to choose music and doing transitions. And so we just want to thank them for really making that episode sing with a little bit of extra shine. And we're hoping to do more of those public health in the field episodes at some point. So hopefully we'll hold on to our amazing interns and guests. Stephanie, is there any other favorites that you'd like to talk about?
Well, I think something that I did a bunch of is talk to heads of hospitals in states that were being particularly hard hit. And I think it's always good to sort of hear from the people who are on the ground and experiencing all that COVID is throwing at them. I spoke to someone in Idaho about Dr. David Pate, who talked about these crisis standards of care. It was a fascinating episode if you haven't listened to it. It talked about, essentially in many respects, rationing care, not giving the best care to everybody because they were running out of beds and equipment and people, and who was the winners there and who were the losers there. And it's stuff that, you don't think about.
Josh, did you want to?
I would say I like the episodes that kind of build one on another. And that series that Stephanie did, I really enjoyed. For me, we've been going back to Hampstead Hill Academy, which is a public school in Baltimore City, from very, very early in the pandemic. I mean, I remember the first episode with Matt Hornbeck, the principal, where he was just despairing that all his kids had gone. He couldn't reach them all. This was during the initial lockdown. And then we started to hear about a few kids are back in school, what that's like over the summer. And then more and more we were able to talk to him until finally he invited us in. And then everybody was so excited to talk to us. I came back, I think, to the school with like an hour and a half of interviews with people. That was like the final exam for Owen and Spencer and their team to piece that together into an episode. But I found that really interesting to put together, to listen to, and to appreciate just, how much kids have gone through, how hard people are working to give them the education that they deserve.
Yes, and big thanks to our interns, Caroline Wang and Hannah Bennett, for also helping to co-produce that episode. They sort of had to jigsaw puzzle a lot of different audio files together. And we've done that before with you, Josh. You took a recorder into the field hospital here in Baltimore at the convention center.
It's an interesting recorder, and it has this like weird kind of microphone on it, and like people come running when they see it and they want to talk into it. So I go in thinking I'm going to talk to one person, and before you know it, like I've got all these different perspectives. So it really takes a team though to put together the episode.
Yes, we look forward to hearing another one of those. So let's talk a little bit about, one of the top questions we get in the email inbox. We get this question all the time. And it's, can 2 or more people who test positive for COVID-19 isolate together in a home? And, our standard reply is yes. Josh, did you want to add a caveat to that?
Well, I would say certainly in a home, and the risk of one person making the other person's COVID worse is small, but it's probably not zero, especially with different variants and things out there. So, I think everything in moderation. I think it's a good idea for people to still do their best to keep on their own if they're sick with COVID.
So it seemed like that was sort of the number one kind of lingering unanswered question that was the through shot of the entire year. Are there COVID questions that you all have that maybe we might explore in 2022?
Well, I think we have these questions that we all really want answers to, and among them are, what is the next phase of this pandemic really going to look like? And, are we going to see Omicron hit us with the ferocity of Delta, or will it be a big disconnect between the number of hospitalizations and cases, and the immunity we have will carry us through? And that obviously could appear quite different in different parts of the world. That's a big question. But I think as we, face these like moment to moment type questions, there are also these bigger questions like, what should be the overall goal of our response to COVID? How should we be reorienting, our thinking about the balance between different mitigation measures and the need of children, for example, to get to school, and for others to be able to have social contact? I mean, the mental health consequences of this extended period are just devastating. I think there are going to be some really important questions. I hope that they're playing out in the setting of fewer and fewer people getting very sick and dying, and not in the setting of more and more people.
Stephanie?
I'd like to know sort of where some of our national strategies are headed, because, for example, you'll see in one city, the city is paying $1,000 per employee to get COVID vaccine, even if it already had the COVID vaccine. They're giving, because there's all this COVID money floating around, they're giving these bonuses, which is great, except for I feel like to keep the pandemic from ratcheting up more, it would be better if we spent that money, say, on sending rapid tests to everybody in the state. So to me, I'd like to know, will we sort of look at examples of where this is being successfully done? And instead of saying, oh, we can't possibly do that, think about a way that we can do it, because I think testing is going to help us get out of this. And I'd also like to see, a lot of people have given up on the people who have not been vaccinated and who said they won't get vaccinated. There's got to be a way to get to some of them. And I applaud the efforts of those who are still out there, still trying to convince those who have not been convinced. But we have the tools to end this, and we are not deploying them in the way that we should.
Well, I think those are all questions that we're going to be exploring early in 2022 through the podcast. But I have a really big outstanding question, and that is, Josh, you still owe us an episode on The Stand for your book club. Have you finished The Stand yet? Because in this episode last year, you told me you had started it. Where are we with that?
Under cross-examination, I will say that I really, really did my best to read The Stand. At first, I thought it was going to be really applicable. Like the plague was incredibly applicable and still applicable. And I probably will reread that again over this holiday, just because I just found it so relevant. The Stand, by like page 350, I started to, my attention and commitment to it as being very relevant to this particular pandemic. I think as they were like motorcycle gangs heading across the country, I decided that maybe it was time to read other things.
Fair enough. I have gotten really into pandemic literature this year, and I do have a few recommendations. Severance by Ling Ma is fantastic. The End of October by Lawrence Wright. Station 11 by Emily St. John Mandel, which is actually coming to HBO as a miniseries. And then coming up soon, I'm working on reading Dope Sick, which is also a Hulu series, but it was originally written by journalist Beth Macy. So that's not necessarily pandemic literature, but it is certainly in the public health realm.
That's a terrific book. And I will just say this, if you do hear a podcast on The Stand, then you will know that my view of this pandemic has turned very dystopian.
Okay. So I will hope to not have an episode on The Stand.
Yeah, that is a dystopian book.
Okay. Stephanie, I know you're a very avid reader. Anything you want to recommend for our readers, our listeners?
I just recommend that you stay away from pandemic literature. We have enough stress in our lives, and I want to escape to fictional places with fictional stories. I don't want to even contemplate in my spare time anymore about this.
Totally fair. So let's wrap this up here and let's talk about what are you looking forward to in 2022? Let's start with you, Josh.
Well, I hope that in the end of 2022, we're not saying that, boy, we're surprised how much we feel similar to the end of 2021. Like, I feel like I'd like to see things in a much better place, not just with the pandemic, but with some of these other challenges. I do think the pandemic has made a lot of other challenges worse, including overdose and violence. And I'm hopeful that as we finally start to see the pandemic subside, that some of those other issues will start to get traction on those too. So I actually, I realize this is a miserable moment with Omicron, but I do hope that we see the progress that we maybe envisioned for 2021 happening in 2022.
Stephanie?
I feel so negative about how this is going because I expected us to be almost out of this by now. And to me, we're just not, and we're nowhere close. And I talk to people who end up telling me, they end up confirming my worst fears that like we are in this cycle. And until everybody's vaccinated, until everybody's got home testing, which just aren't going to happen everywhere. Until that happens, we aren't going to be able to put this in the past.
All right. Well, when things get better, we're going to do another podcast with the three of us, and we'll revisit this with Stephanie, hopefully, so that she can get to a better place.
Yes. I mean, I think, Stephanie, everything that you're saying, our listeners certainly will resonate with them. It certainly resonates with me. It is tough to still be having what feels like the same conversation again a year later. But again, things are better. We know so much more now. We have antivirals. We have better treatments. We are getting better at this. And I do think there's light at the end of the tunnel. So any final words you want to throw out there? Start with you, Josh.
Thank you to all of our listeners for all the ideas. Many of the episodes come from suggestions that we get. And we really hope that we provided some value during this difficult time. And we want to keep doing that.
Stephanie?
Well, of course, I agree with Josh. And it's a pleasure to be able to dig into these concepts in a way that we might not otherwise be able to. And so I love to learn about this. Josh loves to learn about this. Lindsay loves to learn about this. And then we just have this great opportunity to share what we have learned with our listeners. Of course, in the middle of a COVID exposure scare last week, I still was calling Josh saying, Josh, what do I do? My kid's been exposed to COVID. So even after all of these episodes, even in the midst of a crisis ourselves, we still don't have all the answers.
I mean, maybe the next time we do this episode, we're in the actual studio together instead of sitting in our homes on Zoom. So that might be something to look forward to. Josh?
Here's to that.
Here's to that, yes. Well, anyway, thank you both so much for this Stream of Consciousness podcast that we have put together towards the end of a very long but very, productive year. We would love to hear from our listeners. You can email us at publichealthquestion@jhu.edu. We are all going to take a much needed break. And we will be back for season 5 in January, but we just want to say a big thank you. So happy holidays to all of you, and we will see you again in 2022. Hey, listeners, Lindsay here to say that recording a podcast doesn't always go to plan. And we owe a big thank you to our audio engineers for doing their best to make every episode sound as polished as possible. Now, please enjoy the blooper reel from this episode, which we had to record twice because the first time we went completely off the rails. Enjoy. Josh, you still owe us an episode on The Stand for your book club. Have you finished The Stand yet? Because in this episode last year, you told me you had started it. Where are we with that?
We're talking about The Stand by Stephen King.
Correct.
So I don't remember saying that on the podcast last year. Are you going to play the tape?
We can probably pull up the tape.
All right, fine.
Listeners, I have to interject here. We did pull the tape, and it turns out this round goes to Josh Sharfstein. Let's roll the tape from December 18th, 2020. I know that you were trying to work your way through The Stand. Did you finish it yet?
I have not finished The Stand. That's a novel by Stephen King, which I thought might have some relevance to the current pandemic. But by the time I got to the point that pretty much everyone had died in the United States and it was kind of a post-apocalyptic anarchy, I stopped. My reading kind of trailed off, and I thought maybe it wouldn't be that great a podcast episode.
Well, on a personal note, I would like my children's schools to stop sending me letters about how everybody's been exposed to COVID. We had 5 of them today from one of my child's schools. So it's okay. Hold on. Let me try that again.
I think we should leave that whole part.
I think we're going to leave this all in, Stephanie. We don't have time to do the edit.
Such a Debbie Downer. You know, I've told the story before that when Josh asked me to be his co-host, he said we're going to do a daily podcast on COVID. Whatever will we talk about? So I cannot believe that here we are going into 2022, still talking every day, basically, about COVID. You want me to stop that because I said
yeah. No, can you just go back and repeat it because we lost you for 1 second in there. So
okay,
yeah,
start the whole thing over.
Yeah, so I'll just ask you the question again. Okay, so Stephanie, what surprised you about this year? Any of the episodes that we did with the NCRC, which is the Novel Coronavirus Research Consortium. Thank you. There we go. The Novel Coronavirus Research Consortium.
They would take the precautions that were needed. And so it's just a really good in-depth look at how one special community was handling the pandemic.
And they did quite well with vaccinations, if I recall.
I don't remember.
Okay, we'll cut that part out. We're all much better at interviewing than we are at answering. It's fine. Okay,
so that way we can just talk about like ones that we really like during the year.
Okay.
You know? And just keep going, and we'll just keep going more and more and more and more and more. And it'll
that's
be
fine.
Like rather than doing this strategy, which I think it's a sort of.
I was trying to do your homework for you, but
no. I know. But I think we're not good enough.
Right. I think that our memory isn't good enough.
No, it's fine. Okay, let me cut back to, and I'll put some note in there. And
we can just start. We could start again. Do you want to start fresh, and we'll just do it?
We can.
That's my go-to move. Start fresh.
Stephanie, you want to start over?
Sure.
Okay, hold on. Here's what I'm going to do. I'm going to stop recording.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.